Hi, good afternoon to all our Supreme Fertility listeners and followers out there. And thanks for joining another Supreme Fertility Live this afternoon. I'm really excited to be joined by a very passionate and dedicated dietitian this afternoon, Tanya Alberts from the Transform Your Health Network. Welcome, Tanya, and thanks so much for taking time. I know you're incredibly busy to join me this afternoon for this interview.
Thank you so much, Deborah. It's lovely to be here, and it's always good to talk about food. It's good to talk about nutrition, and I'm excited to share some knowledge with you.
And just before we start, just give us a little bit of a background, the Transform Your Health Network. Where is it? A little bit about it. How did you come across the name?
Sure. So basically what happened is I teamed up with a counselor, Sean Buckley, and we decided we wanted to do something different and give something back, and we teamed up to become Transform Your Health Network. So we're a group of dietitians and counselors. We've got around 10 branches in Gauteng. We also see online clients in Cape Town, KZN, and Nelspruit, and then we also have some international clients that we also assist. And we've got coaches and counselors on our team as well as dietitians. And we enjoy just working together, helping people to have behavior change, and also working in the practices. And then we have our online platforms where we run some online programs related to eating, healthy eating, emotional eating, and then obviously losing weight. And then we also have some other programs we run in corporate industry that we run within corporate companies.
Sure. So it sounds like you are super, super busy. So thanks again for joining me this afternoon. I know you squeezed me into your calendar, so thank you very much. And I asked you to join me this afternoon just to chat a little bit about folate. It is one of the common topics that always comes up when people want to fall pregnant and when they're struggling to fall pregnant. And so today I just wanted to chat to you a little bit more about folate and the role that it has in fertility, just like in that line. So thank you very much for prepping around that theme. And yeah, that's what we're going to be talking about this afternoon. A little bit more about the folate.
Thanks. Deborah, I mean, we can start talking about, and I see it as a superhero supplement. It's one of the hot topics when it comes to fertility and wanting to fall pregnant, and that is using folate and folic acid. And is there enough in my body? And I'm sure you know that there are lots of studies out there, and in 2020, they actually did research on fertility, and it came up that 20% of South African couples struggle with fertility, and it affects both male and females equally.
No, absolutely. And I know, well, we're finding a little bit of problems with both of them when it comes up into our program. But how would you, as a dietitian, when you're working with these patients, if they come to you, obviously they're not all infertile. So how would you classify or describe someone as being infertile when they, or also diagnose someone as being infertile? How would you, because obviously everybody's not infertile if they've been struggling for a short period of time or so.
Yes. Well, I'm not a fertility specialist, but the World Health Organization has come up with a definition. They call infertility a disease of reproductive system, and it's defined by the failure of achieving a clinical pregnancy after 12 months or more of regular unprotected intercourse. So that would be your basic definition according to the WHO of what infertility would be.
Now, that's great. So you say more than, I know it's more than 12 months. And often if they're older than 35, we can reduce that age to like 6 months. And the older women, older than 39, even smaller, they're working on a very small time frame, and their time clocks are actually ticking quite quickly. So how
in today's life, a lot of females are actually only falling pregnant much later because they focus on their careers. They're getting married.
Absolutely.
Later, so
when I think about my mom, I think all her children were born almost before the age of 25. And today, most people are only starting families in their earlier 30s. And I think this is one of the causes that we find that links to all these more increased couples struggling to fall pregnant and etc. So Tanya, how do you see the role of folate, particularly in fertility and in helping couples to fall pregnant, etc.?
Let's just start with the basics of folate. So folate is an essential B vitamin that we all need to produce things like our white blood cells, our red blood cells, and our bone marrow. We also need folate for cell division. We need folate for DNA and RNA synthesis. We need folate to transform carbohydrates into energy, and it contributes to a healthy skin, healthy hair, and healthy nails. And having an adequate amount of folate is essential, and it's important during rapid periods of of growth. So during pregnancy, it's important. During infancy, it's important. And also during adolescence, it's important.
So I can see you're really passionate about it and you've got so much to say, but sorry to interrupt you there. But what I just wanted to ask you is, how does folate benefit us? So what does it actually do in the body, and why is it so important?
So I know that we're talking about folate and fertility, but I want to mention a few other benefits that we get from folate. If you take folate and brain development, especially during pregnancy, it is very essential. It's essential to help prevent birth defects of the neural tube. And ideally, research is showing that you need to start 3 months before conception to make sure that you have enough levels of folate in your blood so that you can prevent conditions like spinal bifida and other pregnancy complications. Then when we look at heart health and stroke, folate plays a role there as well, because it works together with vitamin B6 and B12 to reduce your homocysteine levels. And studies have shown that if you have a high level of homocysteine, that your risk of heart disease and stroke is much higher. With cancer, there's also a benefit in using folate. Some of the studies are there's varied research around it, but basically the most prominent things that came up is that if you have a low folate level, it is associated with an increased risk of certain cancers like lung cancer, breast cancer, cervical cancer, and then also stomach cancer. And then when we look at things like mindset and depression. So, I mean, we deal with a lot of emotional eating and low mood, not necessarily depression. I mean, our counselors deal with that. But when we look at mindset and depression, some studies, individuals with depression had a lower serum level of folate. And also when you're feeling bad or down or sad, who's going to eat green leafy vegetables?
Yeah.
Their dietary intake is already much lower than someone who is of a happier mindset in eating. And if you're feeling low, I mean, studies have shown you're definitely not going to grab vegetables or broccoli.
No, absolutely not.
What did come up in the studies was that if you supplement a methylfolate, which I'll explain a bit later, it had a beneficial effect with people who have depression. Dementia is also a thing that a lot of people are talking about. It's uprising, and people are always fearing, oh my goodness, if I'm going to lose my memory, if I'm going to lose my thoughts, what's going to happen? There aren't concrete studies showing that folate will definitely prevent dementia, but folate has an effect on homocysteine, as I explained before, and higher levels of homocysteine there is a link between homocysteine and dementia if you have high levels of homocysteine. And then there's also evidence that suggests that if you decrease or if you have folate, it actually helps to prevent or preserve your memory health. So keeping your brain active with folate. Then when we get to some of your reproductive benefits, we can think about sperm health. So there wasn't a lot of studies on it, but there was a systematic review and a meta-analysis that actually showed that folate can affect sperm quality, it can help with fertility, congenital malformation, and also placenta weight. And then when you look at some of your women reproductive health, studies have really shown that using a multivitamin containing folate helps with ovulation, which is producing more eggs. And the studies found that women taking multivitamins containing folate had a better chance of conceiving than females who didn't. And folic acid also helps the body, it plays a huge role in throughout the body, including things like your ovary health, your whole uterine health. That's what some of the studies shown. And something that affects a lot of us is stress. And I think if you are a person who decided, I want to only fall pregnant a bit later, there is already metabolic stress in your body because you're older. And then lifestyle habits like smoking and bad diet or not exercising or not sleeping well, and then just general stress coming from work or lifestyle. I mean, the last 2 years were quite hectic, so stress levels have increased. And that actually affects how your body firstly needs folate. Your body needs more folate when you're stressed. And it also, those stressful things affect if you would be conceiving easily or not, if your fertility would be influenced. So using folate will definitely help whilst the studies have shown, with stress as well.
And just chatting about folate, that I also just wanted to mention from my pharmacy side of view, a lot of people, when they're taking chronic medications, so things like glucophage, anti-epileptics, Perbac, which is something they take for their skin, etc. When they use chronic meds like this for long periods of time, it can also compromise folate levels, and it can cause all these problems and these things that you've already mentioned. So I know everybody's going to want to rush off to the pharmacy now to buy folate if they're not already taking it, but they could be quite overwhelmed when they get there and they just see this long row full of different kinds of supplements. And if you could just explain to me, are they all exactly the same, or what is the difference between folic acid, active folate, and L-methylene tetrahydrofolate, which is something that we speak about a lot more. So if you can just clarify that for our viewers, just a little bit more before they go and buy the very first thing, or the nicest bottle, or the most colorful thing, or what attracts them most is anything that's got a free gift attached to it, because that's going to be the one they're most likely to choose. So how would you recommend a really good supplement to take, and what should they look out for there? What is the difference between them all?
So there are three folate, folic acid, and methylfolate that you need to look at. Folate is your inactive B vitamin that you naturally get in food. I'm going to give you some examples a bit later about the food. And then folic acid is also an inactive form of B9 vitamin that companies normally add to food. So it's your man-made B9 vitamin, and it's added to fortify food, and it's added to your supplements as well. That's the folic acid form. And then you get your methylfolate. Methylfolate is your active form, and you need to think about methyl as a helmet. This helmet allows the folate to travel anywhere in the body. It's like an all-access pass. So the folate doesn't have to wait for it to cross over into a new system, or to let something else hold its hand to go into a specific area where it needs to start working. So methylfolate is our active form. And when you choose a supplement, it's sometimes better to look for that methylfolate, because we don't always know how our bodies are going to absorb it if we can absorb it. So that would be the difference between the three.
No, thanks. I think that explained it very, very nicely. Now, I did mention all these chronic medications that can impair your folate levels and things as well. But you as a dietitian, I'm sure you'd love all your patients to get all their folate that they need from the food that they're eating. But I know that's not always possible. And what other conditions or are people exposed to every day besides all this chronic medication that I already mentioned that could also impair their folate levels or their ability just to absorb folate effectively from their food? So if you could just mention a couple of those things that you have come across in the past.
Sure. So Deborah, obviously, if you're not mindful of your folate intake, you're not going to get enough. But some people are mindful and they're eating enough of the folate food sources, but there are other factors, things like alcohol disorders. If they're using a lot of alcohol, it can affect the absorption and also how folate works in the body. You mentioned some of your chronic medications. There's also, if there's a mutation in your methyl tetrahydrofolate gene, which you can do with nutrigenetics testing to find out if there's a mutation, because that specific gene has to convert the inactive folate into an active folate for it to actually be used in the body. And then conditions that interfere with nutrient absorption, things like celiac disease or inflammatory bowel disease. And then some eating disorders would also affect the absorption of folate in the body, even if you're having enough.
Yeah, that's you did mention the DNA testing, and I know a lot of people didn't even know that this is actually possible. Some of them are even put off by the price, but what the studies have actually shown that almost 50% of the population has a variant in one or two types of what we call the MTHFR gene that we test for. So it is very, 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 very common. So I would recommend people to actually go and have a look to be sure for themselves to reduce those side effects, risks and things like that from the folic acid buildup in their bloodstreams. Now, in the supplements, as a dietitian and from your professional point of view, how much folate would you recommend and prescribe to patients, and how much do you think they need to get in on a daily basis?
So for someone who's trying to fall pregnant, someone who wants to improve their fertility, you need to have between 400 to 1,000 micrograms, which is quite a big amount to have. And it's not always easy to get it in from your food, especially if there are other factors affecting the absorption. And if you're not mindful, I mean, Deborah, if I had to ask you how many green leafy vegetables do you eat every day? Would you be able to tell me, yes, I'm getting my sufficient amount of folate through my diet?
I'd like to think I try. I have broccoli every day on my plate, but I know it's probably not enough from my little serving of broccoli. Yeah, so probably not. But I think a lot of people don't even have that little serving of broccoli every day on their plates, and they don't even know where they can get folate from. So what kind of foods and things should they be incorporating on a daily basis that contain these high levels of folate, Tanya? So what kind of things should I add to my broccoli on my plates every day?
Sure. If you're looking at foods that are high in the natural folate is your beef liver, which I know not a lot of people like, but they can also look at their vegetables, especially things like Brussels sprouts, leafy vegetables, your turnip greens, spinach, your Roman lettuce, your asparagus, and then some of your fruits, especially things like oranges and orange juice, and then your legumes and your beans and your nuts. So kidney beans, black-eyed peas, and peanuts. And then also look out on your food label, because some foods are fortified, like your cereals, some of your breads, your pastas, and your rice, and there should be folic acid in them as well.
Now, so listening to you, there's really not an excuse to get enough folate in your diet. Even if you don't like broccoli or you don't like spinach, there are other sources, and that's where they need to come and see you, that you can help and assist them. And what I also like about your whole setup, Tanya, is I know it's very, very difficult when people try to change these eating habits and include all these foods, because we're so set in our habits. And often it comes down to emotional eating, and a lot of people with fertility problems that are obese, etc., suffer from these unhealthy emotional eating habits and even a bit of food addiction, etc. So I like the way that you've got it set up with the counseling and stuff also built into your network, which I think is a fantastic way to approach it, because I know it's not always easy for everybody to do. So before I keep you busy, I know you've probably got a whole lot of patients waiting in the patient waiting room to see you, but any lasting words that you would just like to highlight on the benefits of folate, or lasting things for us to leave us with? What would you wrap it up with?
Well, firstly, Deborah, thank you for giving me this opportunity to share just a bit of nutrition. It's always good to share knowledge and to know what is out there and what we can do to improve our health. And if you find it difficult to consume a diet with adequate amounts of folate, looking at the types of food that we've mentioned, or if you maybe have the above mentioned factors that can influence your folate absorption, doesn't matter how much you eat, it is definitely recommended to look at a supplement. Supplementation is there for us to use, and it is there to benefit us, but it should be combined with a healthy diet. And if you are someone who maybe cannot absorb folate because of the mutation of the MTHFR, then again, supplementation would be something that you can use, because it's got that helmet on. It's going to go wherever it needs to go. The methylfolate will do what it needs to do. It's a superhero of the folate. And if you want to increase your chances to conceive, studies have shown that you need to supplement with folic acid, and to increase your chances even more, it would be beneficial to use the folate with the helmet, the methylfolate, because then there's no waiting. There's no, okay, my genes might not work. Oh, I might not be able to absorb it. This folate is going to power in, and it's going to do what it needs to do, work with the different areas it needs to work with. And then before you supplement, make sure to speak to your doctor or your general practitioner or your dietitian or your pharmacist, because it's important to know what you are taking. If you are already taking other chronic medications or other supplements, that you don't over supplement. And remember to use it with a diet, a healthy lifestyle, because you can't just take a tablet to fix everything. It's about the whole person. It's about how we think about food, how we feel about food, our environment, who's around us, and how we're going to implement it to make it sustainable, to benefit our health, and if we want to become more like conceive and improve our fertility.
I wish I'd listened to this talk about 10 years ago, Tanya, because I had to go through a bit of emotional turmoil. Well, I had a little baby that was born with birth defects more than 10 years ago already, and I've actually got a mutated MTHFR gene. So I think there's so much thing people can do just by testing things and by putting the right kind of supplements and dietary changes in place that can reduce risks of things like that happening. Also makes why I'm so passionate about what I do, and just so there's so much you can do to reduce these kinds of risks from happening to us. So Tanya, thank you so much for joining us. I know I'm probably going to be overwhelmed, people wanting to book appointments with you. So if you wouldn't mind just quickly sharing, how can they reach you? How can they get hold of, if you can just maybe share your website and a contact number or so if they'd like to book an appointment with you.
Thanks so much, Deborah. They can reach our team on www.tyhn.co.za, or they can send us an email to support@tyhn.co.za.
So thank you so much again for joining us this Supreme Fertility Live this afternoon with Tanya Alberts on the importance of folate and fertility. Any questions, you can welcome to drop me an email and I will forward them on to Tanya for her just to address in future. So thanks again for your time. Please join us next week.